Hello, good morning, and happy Friday. I hope this day is treating you well so far. We're a week into the GMSH conference. Time flies, and we've been enjoying every minute of it, and hope that you are too. Really happy and excited to be introducing this session this morning. The launch of HQ. Toronto's new home for queer men's health. Right now, colleagues from different municipal governments from around the world, public health professionals, are all gathered in Lisbon for the Fast Track Cities Conference, which is looking to advance municipal responses to HIV. As we know, HIV, here in Ontario, is largely concentrated within urban centers, particularly Toronto and Ottawa. So HQ comes at the right time, alongside persistently high rates of HIV and STIs within our community. HQ is a collaboration that has been really years in the making, in response to the evidence, that we know that combination prevention services need to be integrated for gay and bisexual men, so that we can experience the benefits of frequent testing, early diagnosis, access to care, PrEP, alongside services that support our mental, emotional, and social well-being. So we have a fabulous panel of speakers this morning, folks who have been really influential movers and shakers on HQ. We're going to start with Barry Adam, who is a longtime friend of the GMSH, advocate. I don't think even begins to describe Barry in terms of your work on HQ. And then we're going to turn things over to Osmo Guerra-Menes, who is the new Director of Programs, Engagement, and Inclusion at HQ. We'll hear from Dr. Tim Guimond, Dr. Kevin Woodward, and Praney, Anand, the Executive Director of the Alliance for South Asian AIDS Prevention. If you have questions, we invite folks to submit those through the chat, and we'll answer them in the order that they came in at the end of today's presentation. So without further ado, to give us background on the case for HQ, I'm going to turn things over to Barry Adam. Thank you.
All right, and I'm going to share my screen here. All right, what I want to do this morning is to talk about the background, how we got to the whole HQ idea and have arrived at something very exciting today. And to do so, I want to start at 2015, where really a lot of thinking and work got underway. So in 2015, we were experiencing already a decade of stubbornly high HIV rates among gay and bisexual men. But it was a period where there was considerable pharmaceutical optimism. Treatment as prevention was being celebrated around the world. I went to the 2012 World AIDS Conference in Washington, DC, and they were already thinking about treatment as prevention, leading to the possibility to overcome AIDS by 2020. And also at that time, 2014, 2015, the major studies on PrEP were coming out that showed that PrEP was effective. So there, in some quarters, this pharmaceutical solution was thought to be the beginning of the end of HIV. Realities on the ground, however, weren't quite so optimistic. Work on the treatment cascade showed that testing and treating was not something that just happened automatically and encompassed everybody who was vulnerable to HIV, but rather there remained significant numbers who were untested and untreated. As well, we certainly now know 6 years later that there remain access barriers and there's a very uneven adoption. So even just in terms of pharmaceutical solutions, there remains a lot of work to be done to benefit from those innovations. But in addition, there was a great deal of research work that showed that HIV was never just a single issue, that HIV could not be solved just by addressing HIV, but rather it was part of a number of other health conditions and social conditions that also needed to be addressed if we were to make headway. And a lot of those issues were psychosocial. So a whole lot of work was coming out on social determinants of health that affected vulnerability to HIV. And those included a lot of work on adverse childhood events, including racist and homophobic bullying, minority stress, which concerns how people survive and thrive in racist and homophobic societies and how that affects their physical and mental health. There are issues around migration and community integration, and a whole lot of research done on syndemics, which looked at the effect of childhood trauma, depression, substance use, and violence on people's physical and mental health, and again, on vulnerability to HIV. That also led us, I think, to think more about structural barriers. The traditional approach to HIV prevention was behavioral change and counseling gay men again and again and again to practice safe sex. And that wasn't a bad thing. It produced a lot of change and it brought numbers down. But I think it was clear and is clear that that's not enough, and that to make further progress, other issues have to be addressed as well. And the response of the medical system was part of the solution that needed to be reformed. So even in 2015, there was a lot of work that showed that LGBT people felt apprehension about or experience of demeaning, judgmental, or simply uncomprehending health services, and that led to some degree of distrust and tension with the health system. That research has really turned into an avalanche of showing that one of the problems that needs to be overcome is that there needs to be LGBT-friendly health services to provide adequate health care. One of the results of that a structural barrier has been insufficiently comprehensive STI testing. Sometimes that just amounts to not testing gay men in all three of their orifices. There's research that shows that by only testing one, there's often a lot of STIs that are missed, and that in turn can increase vulnerability to HIV infection. There remain hurdles in providing rapid treatment and PrEP to a full range of gay and bisexual men. And also very clear was insufficient connection to mental health services. So with that, a lot of us started thinking about how to improve the Ontario response. And I sum that up in terms of the need for a one-stop holistic health center in a context of fragmented and under-coordinated services that could appeal to the full ethno-racial and gender diversity of gay and bisexual men. And that's the kind of vision, I guess, that we began to work toward. And the Gay Men's Health Implementation Strategy Committee was pulled together in 2015 with the support of OHTN that included researchers and ASO workers. And our primary endeavor at that time was just to inventory what kind of services were available and to try to think about how to coordinate them better. And one thing we also did was to look at some pre-existing models in gay men's health centers that existed in major US cities. And OHTN funded a delegation, did a quick day trip to Fenway in Boston, which is a very impressive organization that provides an integrated approach to gay men's physical and mental health in Boston. And that helped influence our vision of what we needed to do in Ontario. I also want to mention there are some Canadian precedents too of organizations that have been moving in that direction, such as the Health Initiative for Men in Vancouver, our own health center in Winnipeg, and Max in Ottawa, all of which have tried to address the question of better coordinating and providing more holistic care for gay men and their health. So in 2015, a submission was organized for a proposal for an HQ kind of entity to the Health System Research Fund of the Ontario Ministry of Health. Now that proposal was not funded then, but it did help distill a lot of our ideas of what the model response needed to be in Ontario. That was followed in 2018 by a OHTN and GMSH sponsored mental health network conference for gay-friendly therapists, just again to identify what resources were there and to try to better coordinate them. And the lead committee was turned into a Gay Men's Health Hub committee in 2019, and then revamped into a Gay Men's Health Hub task group under the Toronto to Zero initiative in 2019. So I'll just finish by summing up to say that the vision that we learned from Fenway, and I would say also from Dean Street in London, was the need for a one-stop shop that would provide rapid access to testing and treatment, as well as to PrEP, that reduce the barriers that often existed among family physicians and the medical establishment out there that wasn't necessarily up to speed on HIV, as well to provide a center that could provide a comprehensive assessment of both presenting conditions, but also underlying conditions that people might present with when they arrive at a clinic. Also, the notion of a linkage to researchers who are innovating treatment for trauma, depression, substance use, and more was certainly part of the Fenway vision. They were always bringing in new programs to try to address these specific kinds of syndemic considerations that affected the health of gay men. And finally, I want to stress that we learned from Fenway that the effects were not just in Boston, but there were statewide effects, even nationwide effects in the United States, as Fenway became a center for excellence in how to improve gay men's health. So with that quick backgrounder, I'll pass it on to my fellow panelists. We'll talk about HQ today.
Hi, folks. Thank you so much, Barry, for that.
If you can just stop sharing your screen so I can share mine.
Sorry.
You need to turn your screen share off.
Yeah, I'm trying to get to that button.
All right, take it away.
All right.
Thank you, folks, for having us. My name, and thank you so much, Barry, for that great, hardcore, in-depth foundation information on HQ. So, folks, my name is Osmel B. Gedamains. I use the pronouns he, him, and his. I identify as a queer, cisgendered, Afro-Latino man. And I am currently the Director of Programs, Engagement, and Inclusion at HQ Toronto. So I'm going to give you a bit of information of what HQ Toronto, what it will be, how we will be servicing folks within our communities. And not only that, but I also have my other colleagues here who will also be speaking on the particular services that they're also overseeing at HQ, the community. So first of all, I just want to go and let you folks know, well, what is HQ? So we can go to the slide of what is HQ, Kevin, please. So Kevin will be helping me with the slides as we go along. So he's my Vanna White, per se. So HQ will be a center for excellence in healthcare for cis guys, inter guys, trans and non-binary people. This will be an easily accessible space. It will be safe, welcoming space, regardless of age, ethnicity, gender identity, race, HIV, socioeconomic, immigration status, and also ability. Now, the reason why we want to ensure that this place is a space where folks can actually come in and enjoy themselves, a place where folks can celebrate, advocate, educate, and connect. This is what HQ will be moving forward. It will focus on services such as mental, social, and sexual health. You will hear more, as I said before, from the rest of my colleagues. Let's just move on to the next slide, please. So as Barry stated, HQ is a collaboration of diverse agencies committed to health of cis guys, inter guys, trans and non-binary folks. With that said, we have various agencies that are participating or overseeing collaboration of HQ. So we have folks from the Two-Spirit people of the First Nation. We have AIDS Committee of Toronto Act. We have Black Cap, ASAAP, which you'll be hearing from Praney later on in this panel, and a few other folks. Now, so the biggest thing about HQ is that we will also be partnering with hospital and primary health care practitioners in Toronto to provide innovative and holistic health services. If you can continue with the slide, please. I'm flying through this slide, and please, if folks want me to or want to review the slides, you can. I've already spoke a little bit about the mission. So again, providing a space where folks can feel welcome, where folks can see themselves within this space and ensure that, like there's no barriers that are in place for them to access the services. If you can quickly move the slide one more time for me, please, just one more. And so we can talk about where HQ is going to be located. Now, currently, we are under construction, but we will be opening very, very soon. And with that said, we will be located on the 8th floor of the 790 Bay Street building. That building that's right across the street from Service Canada. So we will be around there. And so with that, the space is just under 10,000 square feet. So it's a huge space, a space where folks can actually come in and just enjoy themselves and ensure that they're receiving the services that they're needing, right? And so I'm really, really excited with the space. I took a little bit of a tour in this space just last week. And I am just excited to see where it is right now. I'm excited to see how we're going to be providing the services, especially the sexual health services. Next slide for me, please. So HQ services overview. So HQ services overview. But before that, I actually forgot to state the time. So we're going to be opening, and I actually said this to Tim and Kevin because I'm like, I never work those type of hours, but you know what? It's hours that are effective for folks within our communities. So we're going to be opening from Mondays to Friday from 12 or noon, as some folks would say. I like to say 12 p.m. to 8 o'clock p.m. in the evening. And so for me, I was just like, oh, why are we opening at that time? But obviously it's because in many cases, folks are leaving work during their break times to come and access the space. Folks are also waiting until after work to access the space. And this is really good for folks to have different type of hours that comes around their schedules. Because in many cases, you want to get your services, you want to know, and you're just like, okay, you know what? I'm gonna go during my lunch break. You can actually come into the space. You don't need to talk to me. You don't need to talk to Kevin or to Tim. All you gotta do is just go to self-service area, do what you need to do, and then you can just leave. And that's the greatest thing about HQ, is the fact that you can just come in, do what you need to do, don't need to talk to no one. We have that whole idea of anonymous, my Spanish tongue tends to do this a lot. Anonymity, sorry. I may be pronouncing that wrong, but don't worry, I'll get good at pronouncing that particular word. But yeah, so those are our hours of operations. We're just gonna move forward to the next slide, please. So social programs. So as I stated before, I'm the person who will be doing the social programming act. Oh, someone just asked, 12 to 3 is brunch? Girl, okay. Don't worry, you can do brunch and still come back and come over and just do what you need to do. So in terms of social programs, there's also what is known as the culture. So we want to ensure that the space is welcoming. So in terms of creating a sex positive, non-judgmental, and stigma-free space/zone, we want to ensure that folks are using the space, are seeing themselves reflected in terms of the workers and volunteers at HQ. This is really, really important. As a queer, cis, Afro-Latino man, I want to make sure when I want to go into a space and I want to speak to someone, in many cases, I want to ensure that that person looks like me, who's been going through the same or somewhat of the same type of experiences that I'm going through, just because in many cases, it's like, you know, sometimes you feel very uncomfortable going into a space and like, okay, well, I'm speaking to this person who probably don't know nothing or are not able to relate to my culture, my background. And so, and this is the thing, or it's just ensuring that folks are feeling comfortable. So again, with that, stating the fact of folks being served in various languages, right? My first language is Spanish. And so in many cases, I have family and friends who are Spanish speakers, who in many cases, when they go to places or health centers, they're not able to adequately converse in English or French. And so it's great to know that at HQ, you can do that. I mean, we don't have every single language out there, but we are working to provide as much languages as possible so folks are able to feel comfortable, folks are able to just move through the space and know that they're like, okay, well, this is my space. This is where I can just speak to someone who looks like me and also who could speak my language. But not only that, but we want to ensure that the space engages in peer and offers peer-to-peer services. We want to ensure that the space is not, we want to ensure the space is barrier-free. So you're coming in, you know, like barriers to socioeconomic status or things like that. We want to make sure that, like, look, I'm not able to spend money on this or that, but I know if I can go to HQ and I can get this information, everything will be great, right? Now, so in terms of services, services that we'll provide is sober and non-sexual and cultural programming. So ensuring information that's focused on social isolation and whatnot. We want to put information that connects folks to community and social and spiritual programs. So again, connecting you with various gay sports leagues, various spiritual organizations that are gay friendly, you know, and connect folks to community and social. Oh, sorry. And connect, most of all, link gay folks to other health and social programming. So social programming, this is such as housing, this is such as employment services, income information. And so it's just allowing you, or the space is allowing you a space, I know that sounds weird, to come in and just feel free to like be part of the programming. Feel free to enjoy yourself and to know that there's folks who are looking after you and stating, hey, you need this, come to HQ. We will provide you this space. Again, all barriers will not be there because we'll be making it an accessible space, a space where folks can be who they are and live, most importantly, live their truth. Well, that's the end with me, and I'm going to pass it on to mental health and substance care programs. So this is going on to Tim.
Thanks. So my name is Tim Guimont. I'm a psychiatrist and a statistician, but today I'll talk about, as the mental health director at HQ, some of what we're planning. So as Osmel and others have said, we're trying to make sure that we have both social recreational programming, mental health programming, substance use programming, and sexual health programming, and that we're doing it in an integrated way. So while we're talking about these three things, we are also spending a lot of time figuring out how these are going to move together. So on the next slide, we'll show you, when we started this project off, we really looked at what were the needs that were expressed by ASO workers at the front lines and family physicians who were referring and trying to find services for mental health and substance use care, and where were those gaps. And as part of our objectives then, we said we really want to make sure that we can offer people some evidence-based individual and group mental health services on site where they're getting sexual health care, on site where they're doing social recreational activities. So it's low barrier, easy to access, fast to access. So that there'll be warm referrals. The person who's helping you with sexual health knows the person who does the mental health stuff and can introduce you and tell you a bit about them before you're coming into a situation you might feel a little uncomfortable in. We want to make sure that it has that spectrum of harm reduction, substance use care that will provide supplies for guys. We meet people where they're at in terms of what they want to approach, what kinds of changes they want to make, and what sorts of things they need help with in the moment. We're also planning to use something called a stepped care approach. This idea is to try to give people access to treatments based on how severe the problems are for them. So the more severe the problems, the more intense services we're going to try to line up and match people with. If things are mental wellness, where maybe a group activity would help them just fine, then we try to make those things. Part of the idea behind stepped care, though, is to help measure with people, is it really working for you? Checking in regularly to find out, is it helping what we're doing? Are you getting along with the team we've set you up with? Are you having difficulties that way? Okay, so on the next slide, when we did that needs assessment, this was some of the key messages we heard. We have to make sure this mental health and substance use care is culturally competent. It needs to acknowledge the intersectionality and the demographics of the unique set of diversity that happens here in a big city like Toronto. We want to address some main issues that GBMSM hit and approach where there isn't much services already. And regularly people said, it's hard to find trauma care. It's hard to find treatments for people who are struggling with emotion dysregulation. And it's hard to find programming for people who are struggling with methamphetamine use or just need harm reduction supports around their meth use. People said, we have so many people, many family physicians says, I have 100 people I could send to you, but I only ever send one because there's just not enough services. So it was like, we need to use our services judiciously and get more access to more people. And then finally, we know that we want to develop and maintain community connections because some of these things could be done in separate ASOs. And so we want to build capacity and make it possible to learn how to do trauma care and then do it right at Black Cap. Do it within ASAAP so that it's more accessible and culturally relevant. On the next slide, I'll show you. So part of our approach is going to be every time you come for a sexual health visit, we're going to check in with you and see if you need some mental health help. We're going to check to see if you need some substance use help. And we're going to have a self-assessment that you can do on your own here or at home, whatever's more comfortable for you as soon as you express that you need some help. We're also going to make sure we have a crisis counselor who's there available every hour that we're open. So if somebody's in crisis, we have somebody who can meet with you right away, whether that involves self-harm, a sexual assault that you're dealing with, or suicidal ideation. We also are going to try to build capacity, like I said, across the system by making sure to train up lots of people in our community on several therapies that we think can help with those needed areas where it sounds like we just don't have enough care already. Teaching people how to do trauma care. So doing educational sessions for the community on cognitive processing therapy and then offering that, offering dialectical behavioral therapy. And we are going to be engaging in research on developing new interventions for methamphetamine use. So those are our big plans. I'm going to pass this over to Kevin to talk about what the sexual health piece, which is kind of the most exciting.
I'm always glad to be the most exciting person. So, I think at HQ, one of the big things that we wanted to look at is trying to change a little bit of the paradigm of how sexual health services are delivered. I think most people are really used to the idea of going into a clinic and waiting for a really, really long time to see someone. But what we want to do at HQ is kind of change that up a little bit to empower folks who are coming into the clinic to do their express testing or self-collected swabs, so that really, as been mentioned before, somebody could walk in on their lunch break, go to our kiosk system and get their HQ account up. It'll ask them a few questions, it'll print out a few labels, you go in and do your self-swabs and drop them off. And really, it's a quick in and out for people who just want to get some screening done. That is on really the amount of time you need. Tim there in the picture has a picture of our kiosk that we are still programming. So all of the things you'll see in this presentation are artist renditions of this. The other real need in the community is really immediate access to PrEP, PAP, as well as HIV treatment. So, you know, with PrEP right now, if you go to a sexual health clinic, they'll refer you usually to another provider. Then you'll get blood work. You'll wait for a week or two to see the clinician who will then start you on PrEP. With PEP, right now you need to go to Emerge and wait for many, many hours. And again, with HIV diagnosis and treatment, those two things have traditionally been quite separate. You may get diagnosed at a clinic and then referred on to an HIV provider at a separate clinic to start your treatment. And that process can take quite a while to happen. And so from a medical and from a sexual health end, really want to bring all of these things under one roof. So because we'll have access to rapid testing at the clinic, we'll be able to institute people on PrEP, PAP, or HIV treatment as needed within the same day, within sort of 24 hours of presentation and blood draw, which represents a real shift in our capacity in Toronto to provide these sorts of treatments quite quickly. So we're able to do that because we actually have an on-site laboratory, which is in the process of being finished right now. It's one of the many things in the construction that's delaying things, but we'll have the ability to do the 4th generation HIV screens, the ones that are traditionally a blood draw that go off to public health. We'll be able to do that screening on site with confirmatory testing by PCR. And what that means is that if someone comes in and gets an HIV test at HQ, we'll have the result of that screening test within a couple of hours. And so that person could be started on PrEP, you know, go for a coffee, come back in 2 hours, and we can start you on PrEP at that point if the HIV test is negative. Similarly, if we have a positive screening test, we can go ahead and do our confirmatory testing, which takes a couple of hours as well. And that same individual could be brought back and started on HIV treatment that day in clinic. So there's been a lot of research and publications looking at rapid access to HIV therapy, for instance, but they all kind of pretended that week between when you got your blood drawn and you saw your provider with the result didn't happen. Your rapid access was the day you got your HIV diagnosis. For us, we're really looking at shortening that period where you come in today, you get your blood drawn today, and your result comes back today. The same thing is true of our STI testing. So we're able to do syphilis screening same day, as well as chlamydia, gonorrhea testing from all 3 important sites. So from the oropharynx, from the anal genital region, and from the urethra. And those can all be resulted within the same day. So, you know, if you come in at 7:45, you probably won't get it till the next day, but it really will be, you know, within 24 hours. So once you've registered at HQ, people will be able to access asymptomatic testing through a kiosk with a tablet. So you'll sort of walk in, there'll be a tablet in the waiting area. You can swipe your card, you fill out a couple of questions, and it'll print out some labels for you. And then we're going to have results given by text or email. So, you know, no more of no news is good news, which we all know is just anxiety provoking. You always worry, am I the one guy where they lost my test? You'll get a text or an email back, depending on your method of contact, that basically will say either, you know, we processed your tests, your results are negative, please call us if you have problems, or please come back to clinic to discuss your test results. And that will happen again, you know, within anywhere from 4 or 5 hours up to the next day. You'll get those results immediately. Obviously, we'll have the ability to do some symptomatic testing and treatment. So we have a full range of physicians, nurses, clinicians who will be working together to provide symptomatic testing and treatment for the full range of sexually transmitted infections and bloodborne infections. And so those folks who come in with symptoms will always be assessed by a clinical team, and treatment will be available on site just as any other traditional STI clinic. Again, for PrEP and PEP, we'll be able to initiate PrEP on the same day or the next day because of our access to rapid testing. People will be able to do their PrEP follow-ups through the same express testing and rapid testing that you're able to access your asymptomatic screening. So once you're on PrEP with HQ, you'll be able to check in at the kiosk. It'll know that you're on PrEP with us. It'll ask you a few questions. offer you if you want to talk to somebody, or if there's any issues around your PrEP, you'll be directed to a provider. But if everything's stable and you're doing well on your PrEP and have no concerns, you'll just get your blood work done, get your swabs done, get your prescription, and be on your way. And again, that can be a very quick, you pop in on a 15-minute break, pop in on your lunch break and get it finished. The other thing is that, again, PEP will be available at HQ. So we'll have all the clinicians there able to do initial PEP assessments and provide PEP for people if you do need post-exposure prophylaxis. The other part of that is then transitioning people from PEP to PrEP. So if someone needed PEP for a sexual exposure, that may mean that you're a good candidate to go on PrEP, and we will be strongly encouraging folks to access PrEP through our clinic as well. And then again, as I mentioned, we really want to make sure that we have the ability to do rapid HIV treatment initiation, and that we can provide ongoing HIV care for folks until they get connected with a primary care provider. I think, working in the sector for a while, I've heard from lots of guys where, they get diagnosed at a sexual health clinic or a walk-in clinic, and then kind of just sit in this waiting game until they get in to see a physician. And we want to make sure that we can, number one, start someone on treatment immediately. We know from lots of the data that that is the best way to go, but then also provide ongoing care for anyone who needs it until we can get that connection with their long-term HIV provider. Whether that takes a week or whether that takes a year, we're committed that we're going to provide all of that care as needed. And that is the end of my slides, and I think I'm handing it over to Praney.
Thank you, Kevin. Good morning, everyone. I don't have slides. I'm just going to talk for the next couple of minutes. Hi, everyone. I am Praney Anand. I'm the Executive Director at the Alliance for South Asian AIDS Prevention, or ASAAP. Oh, thanks for the spotlight. And so ASAAP is a 30-year-old organization. And largely we work in four different areas. That's support for people living with HIV, education for people who might be at risk of HIV and other STIs, settlement services for newcomers to Canada, Toronto specifically, and capacity building. And for us, capacity building means that if you're an organization that primarily works with either South Asian or racialized people, South Asian, Middle Eastern, Indo-Caribbean people, but you don't have expertise working in queer issues. So we can step in and say, okay, this is what we've learned so far from our work. Similarly, if you're an organization that primarily works with the LGBTQ2S+ folks, but you have limited competency when it comes to working with racialized people, specifically South Asian, Middle Eastern, Indo-Caribbean, we can step in and say, okay, this is what we've learned working with these communities for almost 30 years. The idea of HQ is extremely exciting for a small ethno-specific agency like ours, because we've seen that, especially over the last year and a half, the additional impact of COVID, there's a considerable increase in isolation in our communities. There's a considerable increase in mental health needs. And we see that waiting times for testing has also gone up. Traditionally, what we do is sometimes if there are language barriers for our community folk, we accompany them to testing clinics or their HIV clinics or to other social services that they need to access. Now, what's exciting about something like HQ is that it really brings together all the three different areas that we see are high need for our service users. So mental health, sexual health, and combating isolation through social programming. Secondly, I think the strongest aspect of a center like HQ is that it's been extremely collaborative since the beginning. So it's not that this one agency is trying to predict what the needs of a diverse queer population of Toronto would need, but then from the very get-go, agencies like ASAAP have been consulted into developing these programmings, right? So we've had these consultations for many, many, many months where we've been really trying to understand what are the needs of the communities that we work with and what's the potential impact that we want in our communities. I'm particularly excited about capacity building, as I think Tim mentioned, that the idea is to not only have these programmings available at HQ, but then also train ASO workers to be able to offer some of these mental health programs or enhanced sexual health education programs at our agencies. Also, I'm excited about the idea of this knowledge exchange, right? So if there are instances where ASAAP and other agencies can step in and say, okay, we've been doing this for a while and this is what works for our communities, it's exciting that there is room to do that. All that said, I think for a small agency like ours, I'm always a bit cautious of like, okay, is it going to lead to duplication of work? So that's kind of been my, it's a thing that we small agencies have to consider, that the idea should be integration, enhancement, and not duplication of services, because at the end of the day, we don't want to be redundant and not being absorbed by a large agency, right? So that's kind of the thing. And I'm really glad that in all these months that we've been talking about creating services, it's been truly a collaboration. My staff has been sitting on many different committees that are working towards creating HQ, the social spaces, medical services, mental health services, and just even the general layout, right? So it's been a very interesting process, and I'm really excited to see when we get a chance to visit the space. And I'll end with that and open to questions from the audience.
Awesome, thank you so much. It's incredibly exciting. I had a chance to visit the space a few weeks ago, and you know, a lot of us keep hearing it's under construction. It's like well on its way under construction, which is really exciting. So I'm gonna just start by asking the question that's on everyone's mind, which is, when are the doors expected to open? And I put that to any of the folks on the panel.
So I think both Tim and I are a little bit scarred by that question, just because there's been a number of construction delays. So the current date for opening would be probably a very soft launch in January. We have, as you can imagine, with the lab on site, the computer systems we're setting up, we have a lot of things working together. So we're hoping that when we open first, it's sort of what we've dubbed friends and family, but, and probably inviting people from like GMSH to come in and trial out our systems, run through it, make sure there's no major bugs within our systems and the way they're working, with a larger launch for the full public late January, early February. These times are subject to change. They just changed last week because there was a problem with the door manufacturer in the United States that then shifted our timeline. So but it is imminently happening, but we're just hoping that there's no more COVID outbreaks at a manufacturing facility that cause problems with us.
No, absolutely, and it'll be a great way to kick off a new year, I'm sure. Jordan, over to you to open it up for questions.
All right, we have some audience questions. And this came up during Kevin's portion of the presentation. I don't know if it's for just Kevin or the entire panel. But would non-status folks be able to access HQ for PrEP, PEP, and HIV treatment?
Yeah, so the access to the medical care is going to be regardless of whether you have OHIP or not. So that's really not going to be an issue. There's always the same issues for folks about how you actually access medications, but we have people who can work with folks who don't have status to make sure that they can access medications. And in many cases, you can actually order those medications online from overseas, and we have lots of people who do that currently with PrEP. But that would really be the only barrier, and honestly, that's just logistics.
Another question along the same vein, if people don't have access to text or email access for follow-up, can they come for a paper result at the front desk the next day for the testing?
I think we're assuming this fictional person also does not own a telephone at all, like a landline, or they own nothing. Because we can also phone people with results. So even if you don't have access to text or email and you have a landline that you can get a call at, if you have none of those, certainly you're welcome to come back to the clinic to get results. And in fact, for that person who has no way to contact them, we would say you have to come back tomorrow, because if something's positive, we actually have no way to get a hold of you either. So we would encourage those folks who don't have any way to access them to come back to clinic the following day to pick up their results in person and probably to meet with a clinician to go over those results.
Great, that's wonderful. One more from you, sure.
Yeah, one more from the audience as well.
Okay.
Yeah, HQ is labeled as a welcoming, all-inclusive, culturally safe space. And share with us what's in place for trans masculine men.
So there's actually one of the things that we didn't actually mention throughout this is that we will have testing nights that include other drop-in services that happen on a monthly basis for various communities. And so there will be so the AIDS Committee Toronto, Step Forward, is going to be running a trans and non-binary testing night. We're actually, the services here will be open for any trans individual, whether you whatever your gender identity is, you identify as a woman or a man, but we are happy for you to come to get services here. And that means that all of the video presentations, for example, we're going to walk you through whatever you might need, regardless of your genitals, regardless of surgery status. So there's a number of opportunities here to make sure that you can either come whenever you want, or you come in a specific night where you know there's going to be services. Further, we recognize that partly in managing the OHIP requirements, like, we're going to be showing people their dead names. So we're going to be talking to people before they see that on the screen to let them know that this is happening, and to also offer them the services to help them get name changes, so that if you need our assistance, there's some lawyers that have already stepped up that are going to help out with doing some of this. As a clinic, we'll step up and help with the needed letters from physicians to change it. So we want to make sure that the space really does address the spectrum of needs, and as those other needs become identified, we're going to be listening to the community, but what else could we be doing to be helping?
And just to jump off that a bit, just remembering that this space we were trying to make this space very inclusive. We will be having a lot of trans and non-binary programming within this space where folks are actually able to come in and get various type of either digital information or information that provides folks with more ideas in terms of queer competency training, trans competency training, and whatnot as well.
Wonderful. Thank you both. We know like HQ is taking a status neutral approach to sexual health and HIV related care. Could you share some of the specific services for HIV positive queer men?
So I think the biggest thing that we're going to have available for HIV positive queer guys is the high resolution endoscopy. So that's a service from a sexual health standpoint that has been available in Toronto, but a bit difficult to access, and specifically for pos guys where there may be a higher risk of malignancies and cancers of the anal region. That screening service is really important. We actually hope to expand that to everybody. It's just when we start out, we want to make sure that it's really reaching those folks who need it the most. But certainly from the screening standpoint, that'll be available at the beginning. The other part of this is that all of our physicians and clinicians who are working there have experience in HIV care and HIV treatment. So, again, if you go to a walk-in clinic or some sexual health clinics and you need to get screening, but you have a question about your HIV care, oftentimes the folks there couldn't necessarily answer it. Whereas all of our physicians and nurses and clinicians will have that experience. So if somebody's like, hey, I didn't get in to see my HIV physician because my next appointment isn't for a while, but I had a question about my medication that I'm on, or I had an issue around that I wonder is related to my HIV, all of the clinicians there will be able to answer those questions and help them out if needed.
Beautiful. That's wonderful. Thanks, Jordan. Go ahead.
Yeah, we've got a couple more audience questions. So one about cultural diversity. You said the services will be culturally diverse. How is this being done exactly? And is there a role for peer navigators?
Go ahead, Tim, if you're saying.
Why don't you start, and then I'll add if.
Okay. So we want to ensure that all programming is socially diverse, and with that's just why we are also partnering with various agencies. So each agency that provides services to a particular point of the 2S LGBTQ spectrum, we will have those services in place. And not only that, but providing like we also have an art an arts exhibition that's happening in the space where folks who are from the queer community who are artists are able to provide that, provide their artwork within the space so that they can be known and whatnot. So again, it's just providing various programming that is also developed and partnered with the various agencies such as Black Cap, ACT, and so forth who are part of the collaborative agencies. I don't know if, and then Tim, sorry.
And so like the mental health things, similarly, all the mental health services are actually being done with individuals who are working in the different agencies that are involved. So like Praney was mentioning, like the ASAAP frontline workers and gay men's health workers, that they are involved. The volunteers from those organizations are going to be working the front desk and helping in this space. We have a plan for a lot of peer training and peer development as well. And also the staff hiring is diverse, right? So we are going to be able to hire a couple of social workers, and I'd say that hiring is already, making sure we have a key sense to making sure we have both capacity across many different languages, capacity that we have a diverse set of individuals that you're going to see when you come in, regardless of the service that you arrive at.
I mean, and at the same time, we also hope that folks like yourself can actually come to the space and volunteer. So with that said, getting that information, getting out there and just being part of HQ as well, right? Whether in your mind you're saying, well, something's missing, and you're able to come in and have conversations with us and volunteer within this space, I think that will be helpful as well.
Nice, thank you. So another couple of questions that come in. So with COVID restrictions in place, will there be an option for emotional support guests for clients that may like that option? Not sure what an emotional support guest is, so if the Dean could elaborate on that, please.
Yeah, or maybe I'll just maybe rephrase it. So COVID obviously having a big impact on folks' mental, emotional, social well-being. Folks coming into the space, it sounds like there's a few options. One is more support to sort of walk through the services and what's on offer. The other being the sort of self-check, the kiosks that are going to be in place where you actually don't really need to interact with a lot of folks in this space. So maybe if anyone on the panel wants to elaborate a little bit more on that, please go ahead. Otherwise, I mean, I would expect that pending, public health directions in regards to COVID-19, that the space will follow all protocols as required.
Yeah, so, because it is a medical space as well as a social space, we do have requirements that we have to follow from the ministry in terms of, wearing masks and all those sorts of things. The benefit of it being a medical space is that we don't have to do all of the you don't have to show a vaccine passport to come in. That sort of stuff is not necessarily required of the service users, because it's a space that's actually meant to be for medical care. All of our staff will be vaccinated, but we're hoping that we don't have to have a lot of COVID restrictions as our numbers go down over the next little while. So I think today there's an announcement coming out from the government about how we come out of stage 3. So maybe by January, February, we won't actually even be in full restrictions anymore. But I'm crossing my fingers.
Wonderful, thank you. Sorry, Trevor.
So we have another question as well. You mentioned folks will be able to access housing and other services, example OJSP and Ontario Works. Is our hub services space being designed to allow for folks to drop in to see workers?
So at this point in time, as I said before, we will be collaborating with other agencies that already have these services in place. Well, not only that, but we also will provide a resource guide or resource network that will be available on our website or at the space where folks can see the different type of resources that are available to them. We're hoping that in the future we will expand in possibly having those social workers or those particular workers in the space. As I said before, we will have some volunteers from the 9 agencies who will probably be in the space and who will be able to help. So we want to ensure that the programming that's already been in place continues, and we want to ensure that we provide we tick every single box in terms of social programming.
Yeah, Osman, if I can add something to that. So again, the idea is that a lot of people who would be at HQ would be already working at different agencies like ASAP, right? So if you're a walk-in client at HQ and you get a chance to speak with another agency person, there's always that connection that can be made organically, or that warm referral that we were talking about. Right? So if you are, let's say, a South Asian person or a Middle Eastern person coming in, and in the needs assessment, it's recognized that you would want to connect with an ethno-specific agency and perhaps like expand your social circle, get to know a little bit more about specific agencies that can serve you in terms of not your just like the immediate concern around getting a test, but other needs, then that warm referral can happen through sort of like the ASAP person working at HQ, or through the warm referral that we've been talking about. Also, a lot of times we, as I said, we accompany our service users, ASAP service users, to these health clinics, et cetera, especially when they have, when they're facing language barriers, or just like really trying to get to know the system a little better. I've lived in Toronto for 6 years and I still struggle with just navigating the healthcare system. So imagine for a newcomer, it's sometimes really stressful understanding, do I need that OHIP card? Would my results be outed to somebody? Do I need my name? What's going to happen to my results? So we mostly accompany our service users, and we have care navigators to sort of navigate that for our users. And the hope is that they would be able to accompany folks to HQ as well and offer that emotional support and that warm referral during that moment as well.
And I think the other thing that I just wanted to mention, sort of going off of that, is that the kiosks and computer systems we have actually have the ability to display in multiple languages. And I won't say the number because Tim will yell at me because I get the number wrong. But I know we have at least 12 to 15 languages that we're already able to support with those systems, and we're adding quite a few more. So the hope is that pretty much whatever language someone is most comfortable using, they can use that in their interactions with the systems at HQ to try and avoid some of those initial barriers that a lot of people feel when they're trying to access healthcare in Canada for the first time.
Great, thank you. Before we wrap, I have one final question. HQ obviously represents a significant investment from the Ministry of Health, who, like all health ministries, are going to want to see results. 5016 Street in London was attributed with an 80% drop in HIV diagnoses among gay and bisexual men in a very short period. How are we going to be able to attribute success in HIV prevention among gay men to HQ?
So one of the benefits of starting a new clinic is that we actually get to design things from the ground up in terms of the data we're capturing. Because we have an electronic medical record system as well, we're really looking at not just being a site for providing good, mental health, sexual health care, social services, but also getting that data out. So looking at, our rapid PrEP, for instance, and comparing that to uptake that we've seen in other PrEP clinics throughout the province, looking at rapid HIV initiation, and then looking at the numbers for the province in terms of overall HIV diagnoses and what's changed over time. The one caveat to that is that the province is about 3 years behind in providing some of that data. So, we're going to be beholden to them to see if the provincial rates change. But within HQ, we really want to make sure that data drives some of the things we do as well, and that we're responding to what we're seeing on the ground coming into the clinic.
Fantastic, thank you. Well, we have come to noon. Osmel, welcome to your first GMSH conference. It was great to have you and to meet you. I want to thank all of our panelists and presenters, my co-moderator, Jordan. I feel like the anticipation for HQ is so high, and I know folks just can't wait to get into the space. Not only does it respond to the evidence of what we know works for gay and bisexual men, but also is built on really, really important and strong values.